comes down in studio wearing his Kentucky getup. Yes. Dr. Jason Hunt from Kaizen Orthopedics is with us live here in studio. What's up, Doc? Great to see you.
Great being here. Thanks for having me.
It is good to have you in here because, wow.
No?
Okay. We'll bypass the Kentucky Wildcats and, Wildcats going to be all right. It's early in the season. Nothing matters to March anyway, right?
That's right. They did expose us, but it's good to know.
Yeah.
So, Doc, you came in and Ronnie's been, crying about his Achilles, and you did a little examination on it. What did you find out? Is it torn?
Yeah, I think probably for the next 7 to 10 years, no more bike riding in the wind.
Oh, come on. It takes a while for an Achilles, right? When it's inflammation, you said
It
that?
does, and it's a soft tissue injury. The same thing we go over time and time. It's like when you have soft tissue, it's not predictable. And it takes a long time, so you'll be fine.
So just got to ice that thing twice a day and take some anti-inflammatories. That'll be fine, right?
Then you'll be back on that bike.
That's what the doctor said, man. That's what I'm going to do.
And I appreciate, Doc, your advice following my little mishap that took place, a week ago Friday, about 10 days ago with a car accident. Obviously, I was shaken up. I was dazed for a couple of days. Thankfully, no serious injuries, but it does have a psychological effect as well as a physical effect on a lot of people, doesn't it?
It does, and it's the same for all injuries, even if we're talking about sports injuries, because when first time you plant your foot and cut, you don't know if your knee's going to work. Or it's the same thing. Anytime you come back from an injury, it can shake you up mentally and physically, and that's part of our job when someone comes and sees us, is let them know that this is a little more than just soft tissue healing, because that's going to happen. There's a stepwise process to get back to be 100%.
All right, let's get to some of the NFL injuries. We saw yesterday the Pro Bowl, where they're not supposed to be playing as hard as they played yesterday, but some players, got a little chippy and decided they're going to play hard. One of those was Kirk Cousins, the quarterback of the Washington Redskins, risking injury like a madman, running down the field at 100 miles an hour to strip the ball from Aqib Talib. Now, when you're chasing somebody like that, all kinds of things can happen, right?
Sure, especially when you're a quarterback and you're not used to doing that, so they could tear their Achilles. But at the same rate, that's one of the things that endear us to athletes is sometimes when they get in the game and those juices are flowing, they want to compete, and that endears us to those people. But also, it's if you look at risk and reward, everyone in Washington saying, "What are you doing? You should never have your quarterback chasing them." In a Pro Bowl, try to prevent a touchdown.
Well, especially the fact that he's not signed, and they'll probably franchise him for $24 million over 1 year. That's a lot of money to be putting on the table there.
Right.
It is. Michael Orr still in concussion protocol. How long can this sort of thing last?
It can go. It's probably the most individualized injury that we see and deal with are concussions, because we're dealing with something that's unseen. It's not a bruise. It's not something you can see on the outside part. And it's a brain injury from the standpoint that the brain tissue is bruised. And so that protocol, the reason it's set in place is so you can stepwise fashion know that there's a resolution of the injury. And when you have a setback, that can mean one of two things: that you're not doing the proper steps that you're supposed to be doing, or that the injury was more severe and you're not able to go to that next step. So I'd say out of all the injuries we deal with, it's the one that's least predictable. But also the one that's most specific for that particular injury. If someone tears their Achilles, we know what that happens. Someone pulls their hamstring, we know what happens, but we can't see. And then the information we have for closed head injuries is still relatively new. We're still learning about concussions.
Dr. Jason Hunt is with us in studio, but the fact that he's still in the concussion protocol, that's got to be a serious issue for that young man, certainly. I want to ask you about Ryan Tannehill. Partially torn ACL. He's not going to need surgery on his knee, but I guess one of the factors or one of the treatments he's considering is going over to Germany for the PRP plasma. Explain that PRP little therapy there.
So everyone knows that Kobe Bryant went to Germany and had this PRP, and it became a craze after that. And one of the differences is there's PRP treatments in the United States. But the reason people go to Germany is it's less scrutinized, and the treatment's a little bit different, because when we take a person's blood and spin it down and get these platelets that we're talking about for PRP, we can't manipulate human tissue according to the FDA. And so that treatment in Germany is manipulated. They heat up the blood and they try to kind of promote the proteins for healing. And so that's the difference in the PRP that you would see here and the PRP you would see in Germany. And healing, I mean, the inflammation part of healing is real and it happens in everyone, but we're trying to basically diminish bad inflammation and promote healing when you start injecting the PRP. There are a couple people in the United States who are doing the same sort of treatment in Germany, but it's very scrutinized by the FDA, so it's something that not many people are into here.
All right, Super Bowl 51 coming up Sunday, as we all know. The Atlanta Falcons, the New England Patriots, and Julio Jones, the big gun in that receiving core for the Falcons, aggravated a toe sprain, played through that in the championship game. So what is he dealing with when we talk about a toe sprain?
Really what he's dealing with pain, and if you look at his performance from before, you're thinking that you doubt that there will be any setback for the Super Bowl for him. But the main thing he's dealing with pain, and my guess is that he'll get a shot and he'll get some treatment to play and he'll be fine. He'll be dealing with some off-season pain and discomfort, which all the players will be. Everyone who makes it to the Super Bowl by that time and take a recovery period, and I think he'll be just fine.
And the 2-week layoff will certainly help him, absolutely, with that. I want to ask you about Teddy Bridgewater, because this report came out over the weekend that he may not play in 2017 because of the dislocated knee, the torn ACL. He completely shredded that knee. And according to this report, the recovery time was 19 months. Is that something that, does that sound about right?
Yeah, when it first happened, there was a lot of us who said he may never play again because of the devastation of the injury. Now, obviously, we reconstruct the entire knee, and the hardest thing is there's nothing to compare it to. It's a gruesome injury. We don't have. If someone tears their ACL, we have tons of ACLs to look at and compare. If someone tears their patellar tendon, we can look at that. And for his injury, it's very severe, and it's definitely from day one was career threatening. What we worry about is that nerve that goes around the knee when you tear everything. If that nerve doesn't wake up, you can't perform on the level that you could. And no, I don't think we know that yet. But the timeline for 2 years to return to full competition is reasonable.
Dr. Jason Hunt is our injury expert, WDAE from Kaizen Orthopedics. And last one from me here, Alex Mack, who is the center for the Atlanta Falcons, injured his left fibula above the ankle. So it's not fractured, but it is injured. So what's that injury like?
Well, it depends. You can have a fracture above your ankle, which is similar to the mechanism that you can have for a high ankle sprain. So it's basically the energy from the sprain will go out through the fibula bone high above the ankle, and the fibula bone is not the major weight-bearing bone on the leg, so it certainly causes pain if you have an injury to the fibula there, but it doesn't diminish function as much as it would if it was at the ankle joint, because your ankle's not unstable.
So a couple of weeks of rest and treatment are going to help him tremendously as well.
Definitely.
Extra week off helps him too. All right, he's Dr. Jason Hunt, drjasonhunt.com, Kaizen Orthopedics. Thanks for coming in, Doc. Great to see you, buddy.
You got it, buddy. Thanks for having me.
Come in more often. We like it when you're in the
Yeah,
studio.
you got to look over Ronnie because the